Hello, good afternoon. Welcome to Dr. Stephen's Hospital to this staff webinar. We're joined by the Chief Executive of the HSE, Paul Reid, the Chief Operations Officer, Anne O'Connor, and the Chief Clinical Officer, Dr. Colm Henry. They're going to give you an update on the vaccination programme this afternoon for our staff. We've seen, as you know, more changes this week in light of what seems to be daily news on what vaccines should be used for what population cohort, daily news on deliveries, with the suspension of the planned use of the Johnson & Johnson vaccine. Then some apparent good news yesterday in the shape of an increased supply of Pfizer vaccine in this quarter. So we'll talk about that. The questions we've in so far aren't only about the vaccination programme, and in responding to them, Paul, Anne and Colm, we'll talk about what's been a very challenging first quarter, I think, for all staff across our services, the pressures we're all facing, and they'll talk about how they see the next quarter. So the webinar is being recorded. For those who who are going to miss it, it will be available afterwards on the HSE staff website. And please put questions in the WebEx chat function, and we'll get to as many of them today as we possibly can. So just before we go on to questions which have come in from staff, I just have maybe a question for each of the participants here. First, Paul, I suppose an obvious point, the staff have come out of a really difficult quarter, a very difficult year. And what would you say to staff now as we look forward to a new stage of managing the pandemic and as we look forward to a new phase, hopefully, in the vaccination programme?
Thanks, Mark, and good afternoon, everybody. It's great to talk to you all again. I guess what would I say to staff today? It's firstly to reflect what's probably been one of the most difficult quarters, not just in terms of COVID over the past year, but probably one of the most difficult quarters that the health service has faced. I know that we've faced many winter pressures over many years, but I think the combination of everything that's happened this quarter has put tremendous stress and duress on the whole system, whether that was the impact of COVID and the number of patients that we had to deal with in our hospitals and our community services, but also at the same time rolling out and scaling up to deliver a vaccination programme. And I think it was kind of brought home to me quite strongly at one of our media briefings. We had Bernie Waterhouse, who's a clinical nurse manager in St James's Hospital, and we had invited her along to talk about her experiences just post-Christmas and into January. And she was talking about at Christmas time when she left, she had 6 COVID positive patients in the ward she was dealing in St James's and a ward in one ward. And then in a very short space in time, over a couple of weeks, that became 60. Instead of one ward, 5 wards with COVID patients. But on that day, I could see the absolute stress that she was experiencing. And while it was helpful for us to let Bernie relay those pressures to the media, I could see the huge pressure that it was taking on her. So that's just to reflect that I know the pressures that's been on everybody, and I want to thank everybody for it. Second thing, very briefly to say in terms of that is, I did on your behalf, and we did on your behalf, reflect those pressures back into government in terms of making the decisions on restrictions, whether they would continue them, increase them, which is a difficult decision for government. But certainly what we relayed was we cannot let the health system come under that pressure that we were under between January and through February again. And we have to take every measures to protect that didn't happen. And I know that's been difficult for the public. It's been difficult for the economy, but I think government did listen in terms of how we reflected that. Finally, I can say as we do look forward, I think we can all look forward with a much greater light and hope. Many of the key measures that we're watching at the moment are really positive, certainly in terms of the trends and the virus and the cases, transmission levels, all really positive. Hospitalizations, ICU, all really positive. But in particular, the vaccination programme. The benefits that we are seeing already and realising already from the completion of the vaccination programme to the most vulnerable are giving us huge benefits in society. It's still early days, and we're still only at the stage of vaccinating the most vulnerable, and still many to go. So I just want to thank everybody for what's happened. We do have your back. We did reflect the pressures that's on your behalf. I think government listened, but I do think we're in a much better phase ahead.
Okay, thanks, Paul. And a question for Anne O'Connor, Chief Operations Officer. We have heard a lot of feedback from staff over the months of the stress and the pressure and the toll that the last year has taken on the physical health and the mental health, indeed, of staff throughout the service. What kind of supports have we put in place to support our teams and support our individuals over that time?
Yeah, Mark, so I think just, I suppose, picking up on where Paul said, we know that it's been a very difficult time, and we're now talking about a difficult year, not just a difficult few months. And there are a number of things that we've developed over, I suppose, really since the beginning of the pandemic, not least the, I suppose, the mental health and psychosocial framework that we developed a number of months ago. In reality, though, we know that for many people now, this has really taken its toll. We know that there are many of you out there who are really tired, apart from anything else, and potentially a bit burnt out, and possibly this is impacting on your work or on your family life or whatever. But there are a range of supports there. So we now have supports available at an individual level and at a team level. So in terms of an individual level, we have supports there. So for anybody who feels they need any kind of mental health supports, we have our employee assistance program. And the first port of call for anybody should be occupational health. We've a lot of services now available. So in terms of accessing occupational health, to be able to go to psychosocial supports, to be able to even access physio supports and other clinical supports. We are taking this very seriously. We are looking at how we can enhance the supports available to staff, and we're currently looking at how we can even have specific appointments and rehab for staff who are potentially who've had COVID, but also staff who are just in need of other supports because of the work they've been doing. At a team level, it's worth, and it's good timing, Mark, in terms of where we're at now in April, because we know that on the 30th of April, it is healthy or kind of workplace wellness day. And we'll be launching our healthy workforce framework on that day. And that'll also allow us to launch the Work Positive program. And the Work Positive program is targeted at teams that may be struggling. So if you have a team, or if you're a member of a team where you're all just struggling in terms of being burnt out or being tired, this will have a survey for you to take as a team. And we will have supports available to work with you to identify the areas that may be challenging, and then to work with you in terms of the supports that your team might need. So that will be launched on the 30th of April, and it's something that I would encourage all of you to look at, and also to encourage any of you who are struggling to contact occupational health, to be referred there. It is a really positive thing to do if you're struggling. There is no shame about it in any way at all. There are supports available. So I think, Mark, we've a range of different things that we would encourage staff now to avail of, given the length of time this has been going on. And also the fact that in the health service, it's not like everybody can go off together now and take a break. We are still busy. We can see that our regular activity is now scaling up. And we are also heading into the time of year where we want people to try and take leave. So for people who haven't taken leave at a personal level, and for managers of services to support people to take leave, it's very important that we do it, because no sooner will we come through this than we'll be getting ready again for next autumn, next winter, and so on. So we do want people to take their breaks and to look after themselves.
Okay, thank you. An opening question for Colm Henry. We see obviously the reports all the time about the difficulties facing the vaccination program, the challenges. Even this week, we've seen quite a number of changes, and we've had to recalibrate the program. But in the middle of all that, we could forget, I suppose, the benefits of the vaccination program, particularly for healthcare workers. And Colm, can you give us a sense of the benefits that have been seen so far in the first 3 months?
Well, first, can I just acknowledge and pay tribute to all the people involved in delivering vaccines up and down the country, in the community, in GP practices, in our own hospitals, everywhere. They worked at a furious pace throughout January in really difficult circumstances when the pandemic was raging through hospitals, and was raging through nursing homes and residential care settings. I couldn't imagine a more difficult scenario or difficult environment in which to roll out a vaccination program. But we're seeing the real benefits now. Of course, back in January, we had some advance notice from other countries such as Israel as to where the direction of travel was. And what we're seeing in real world experience are benefits beyond what the trials even envisaged. And to give you a flavour of those, healthcare workers as a proportion of positive cases were well up 15-17% in some cases, and now have collapsed to being less than 3% of the total number of positive cases we're seeing. Healthcare workers in acute hospital settings in the week of the 17th of January, when the pandemic was raging through our hospital system and bringing some of them to their knees and to the point of viability, we had over 1,000 healthcare workers positive. Now that's down to a trickle of 11 in the last reported week. And this is better for healthcare workers. They're now safer at work, but they're also keeping patients safe, and they're keeping services safe, because many of these services were under huge threat in January when we simply didn't have people there to come to work because they either were sick with COVID or they'd been in close contact. So one of the early real benefits of this program has been the collapse in cases and in healthcare workers, and the collapse in a number of outbreaks in nursing homes, residential care settings, and hospitals.
Okay, thanks, Colm. And I see the first question coming in from some of those watching, which is about the huge backlog people have seen growing in lots of different services over the past year as we've dealt with the pandemic. And the question is, will the HSE be given the resources to meet that massive backlog? And I suppose, have we a big mountain to climb in terms of dealing with that?
Yeah, I'm happy to just briefly, Mark, make a few comments on that. First of all, we do acknowledge, and we've seen the impact of each wave of this virus to date, whether it's the first wave, second wave, or third wave, where every time we try get back up and restore services, we're hit again, and it impacts on, particularly on waiting lists. To say a few things on it. Firstly, we are working with all of the services, acutes, community, mental health, disabilities, and how we scale back up some services. But important to point out, this time we didn't cease all services, so that's an important one too. In terms of funding or resourcing for it, there's two ways I'd just say that. Firstly, our National Service Plan for this year, 2021, has been the biggest budget, again, we've ever had in the history of the state for health services, but it's a 21% increase on last year, so it's over 4 billion euros extra. It's about 3.5 billion euros extra versus last year. About half of that budget is geared towards the knowledge that we have to sustain dual pathways and protecting against COVID, of the extra budget, I should say, and about another half of that extra 3.5 billion is geared towards helping us invest in new ways of doing those services, and indeed trying to catch up with some of those services. And the final piece in terms of funding, two extra pieces. One is there is an access to care fund. It's about 210 million euros in the budget, which we're working jointly with the Department of Health on, which is a fund to start to assist us in helping some of the backlogs, particularly in terms of waiting lists. And we're working through about how we would best utilise those funds. And then finally, just in terms of resourcing, I think we're at a really good point to be able to now strategically recruit for the health services in a way that we weren't able to before. We always had some budget, but we didn't have a budget that looked strategically at the right medical, professional and support skills that we can recruit. So thankfully this year, we have a budget to recruit up to about 16,000 staff. We have 7,000 staff extra starting this year based on what happened last year. But ultimately, we have a budget of 16,000 staff to recruit in the right places. So we have some funding. I don't want to, for any minute, state that this is going to be easy. I know the extra demands on us. And the one last one I would point out is, I think we have to look also at the health system as one national health system. And certainly this wave, we had the support of the private hospitals, and that worked for us. And that's something we need to think about this phase also. But then finally, equally, how do we invest in our GPs and having access to diagnostics, or reducing the pressure and waiting lists, trying to address them in the community in a different way?
Okay, I saw a few questions coming in before the webinar began about the sort of somewhat confusing number of changes that have been announced this week in relation to the vaccination program. First, we had the bad news in relation to the limitations of the use of Astra Zeneca to people over 60, the suspension of the use of the Johnson & Johnson vaccine. But then the good news yesterday, perhaps, that there's a very large additional Pfizer allocation coming to Ireland in the second quarter. Can you make sense of that for us? Can you give us a sense of the current level of optimism or otherwise in relation to the vaccination program based on this week's news?
Well, as I say, what we call the real world experience, which we're getting initially from Israel, the United Kingdom, but now from our own country, is that the gains, the program, the protection of vulnerable people, older people, of healthcare workers, of services, is beyond what we could have hoped for based on what were called the phase 3 trials. And we're beginning to see the real impact. I mentioned earlier about the collapse in the number of healthcare workers. We haven't had an outbreak in a nursing home now in 2 weeks. During the month of January, we had 7 or 8 outbreaks per day. So we're seeing huge gains. What I would say too is that if you go further ahead into other countries, what we're seeing now is in terms of additional benefits, is a real reduction, huge reduction in the serious effects of COVID among people who are vaccinated. That means hospitalization, intensive care, of course, death, and that spans all age groups. We're all seeing more evidence. I see one of the questions coming up there, can you give it to another person? We're seeing evidence that there's reduced what we call asymptomatic disease. And that really is a proxy for passing the illness on to a noteworthy study done in England and showed that people who were household contacts of vaccinated healthcare workers were much less likely to contract the virus than those who were household contacts of unvaccinated healthcare workers. So the evidence is now building up, not just of reduction in serious illness, not just of reduced pressures in hospitals and healthcare systems, but of reduced asymptomatic disease and hence reduced transmission. There's every cause for hope based on the results we have to date. Of course, there are unknowns ahead of us, such as these variants, the variants we know about. The vaccines are effective to a certain degree, and more evidence coming through there showing that they are still retain that capacity to reduce serious illness. But of course, viruses can mutate on multiple occasions, and other mutations may develop. But the evidence we have to date gives real cause for hope for ourselves, for our colleagues in healthcare, for our services, and for the whole country.
Okay, thanks, Colm. We had a very strongly worded question came in this morning from a member of staff somewhere, complaining very strongly about the delivery of vaccinations out of sequence, and not just external to the HSE, but that among HSE staff, this person said there were some people who could by no means be described as frontline healthcare workers, nevertheless received vaccinations out of turn. What's our position on that?
I'm happy to make a comment, and I want to make a comment as well, but take it from a couple of perspectives. One, vaccination programs, and we've said this very publicly, are built on trust. There's no absolute control that we can have other than prioritising the groups that we want to do. And I have to say, in the vast, vast majority of cases, that's exactly what has happened, both from the prioritised groups we're addressing, but also from the public who are very patiently sitting and waiting back for their turn to be called for vaccination. So I think we always need to put in context. People have generally put great trust and applied that trust to the vaccination programme to date. Second thing I would say is we did give very strong clarity to the system around the utilisation of the vaccines, and if at a point in time there were some spare vials or some spare vaccines, how each service would work to a backup list. And generally services have done that well and brought forward staff. Third thing I would say is, and we've defended this quite strongly publicly, I know that many of our health services brought forward many people who wouldn't be in the actual strictest definition of frontline healthcare workers. But we were during January and February dealing with massive outbreaks, massive healthcare infections carried into the services, acquired infections. And that was a real problem for services. So they were vaccinating people to try protect the services and protect patients as well. Now, having said all of that, there are obvious cases where people have put themselves forward out of sequence, probably haven't been validated at the right point in time at the vaccination, and did get through the system. And that is unfortunate. And, I don't use this term lightly, but, when we do rely on trust, equally if someone breaches that, it's cheating. And it's cheating a very emotive process about trying to prioritise those people who are, in the queue for it. So I would put it in context from what we've looked at, certainly within the healthcare system. There have been some minor breaches of that. Generally, it's been well. There are some other very clear and public breaches of it outside of the control of the HSE. And I think they are very clear to state them, obviously, in terms of the beacon. Also what happened in the COO, and there's a report on that in the COO, and other incidents. And, we've been very public about that. But I would just reassure everybody, I do defend where, what may not be perceived as frontline healthcare workers were prioritised by the services. I don't defend where somebody just went absolutely out to breach it.
If I could add, Mark, a very valid point made by the person making the question, but let's judge in addition what happened as a consequence of the vaccinations during January. As I said earlier, you couldn't imagine a more difficult environment in which to roll out mass vaccination in hospitals and nursing homes. For example, in nursing homes, they had to reach 580 nursing homes. Their teams, GPs were included as part of that. And the outcome we see, whatever breaches happened, and many of which shouldn't have happened, but the outcome of that is, as I said, a collapse in outbreaks, a collapse in mortality of older people, and a collapse in cases among healthcare workers. And much of that success was due to the fact that we weren't looking over people's shoulders when we asked them in the middle of, as the pandemic was raging, when we asked them to get out into nursing homes, into residential care facilities, and into hospitals and vaccinate as many of the team as they could to give protection, to protect the team, protect patients, and to protect services too.
Okay, thanks, Colm. And I see two related clinical questions coming up on the screen. Firstly, do people who are fully vaccinated still need to restrict their movements if named as a close contact? And secondly, can anyone vaccinated still pass on the virus?
Well, the second question first. You can still, what the vaccine does, there's solid evidence at the moment, is it reduces serious illness if you contract the virus. There's some evidence emerging now, it stops you contracting the virus, becoming an asymptomatic carrier, which is good. And certainly that would support the contention that it blocks you passing on the virus to someone else. That evidence is building up. It's not solid enough for us to say yet that we're definitively certain that the vaccines in a population level block transmission, but it's gaining currency all the time. The second question, yes, people who are fully vaccinated, if they're deemed to be close contacts, this has come through NEFIT, and in terms of how they should be deemed and what restrictions apply to them. I think that's come through NEFIT now, which means that when people are fully vaccinated, the same rules as apply to close contacts don't apply to them. So certainly is one of the benefits of being fully vaccinated. But that's upon completion of being fully vaccinated and 2 weeks after or 1 week after, depending on the type of vaccine you got.
Okay, thanks. And how would we advise somebody age 65 who decides they don't want to take AstraZeneca in light of all the coverage that's happened over the last while? So I think from 10 o'clock this morning, people age 69 have been registering to be vaccinated with AstraZeneca. But what would we say to people who say, do you know what, I don't like the sound of that?
Do you want me to take that?
Yeah.
What I would say is that the AstraZeneca vaccine is very effective. It's an extremely effective vaccine. It reduces serious illness, hospitalization, and death, and that the benefits are particularly rise with age. So for somebody who's 65, as is in this question here, there's a huge reduction in the chances of them becoming seriously ill as a consequence of contracting COVID-19. And COVID-19 still represents a considerable threat to them, even with this falling community transmission levels we see. As when dealing with the earlier question, we're still seeing cases, we're still seeing transmission, and it still presents a risk to people, and that risk increases exponentially with age. So I would say to people who are in doubt, seek advice, read up the information. If you're worried about this reported clotting event that has happened, that's been reported by the EMA and reported by NIAC, these are very, very small numbers. The great majority of these, and there's been an in-depth review of 86 by the EMA, have been in people less than 60 years of age. Very few reported in older people. It seems to be a phenomenon with younger people, and maybe that's a function of how this vaccine was directed towards healthcare workers in the first instance. But I would say that the balance of risk, I'm saying this especially to anybody who's concerned, is the balance for you of benefit is hugely in favour of you getting the vaccine and protecting yourself, which will afford you great protection from serious illness due to COVID-19.
And another vaccination question. Do the available vaccines at the moment cover the new variants, the various new variants that we're hearing about?
Well, if we go through the variants, the first one is the B117. That's the UK variant. I don't think we can call it a variant anymore, Mark, because it's now about 95% of cases in this country on the whole genomic sequencing are due to the B117. But yes, it's effective against that. The next is the 351 variant, which is the one that the South African variant. There was some concern a few months ago that it didn't have a real effect on mild or moderate disease, but there's evolving evidence again that it's very effective at preventing the most serious illness in this group. P1, it's again it's got that 484 mutation that leads to worry about vaccine effectiveness. No compelling evidence that it's resistant to the vaccines to date. But obviously, we have a small number of cases in this country to date, a small number across Europe. So there's evidence accruing in this. So the fear about mutations, of course, these variants are concerned. And one of the criteria for variants of concern is something that is resistant to existing public health measures. There is no strong evidence that there's widespread resistance to existing vaccine among them. But we know the vaccine companies as well are adapting their vaccines and continuing that research that led to that fast-track development and production of vaccines in the first place to accommodate these new variants and any new ones that might come along. The public health measures, of course, are really important because we're the quite stringent public health measures and quarantine measures in Ireland, among the strictest in Europe, are ensuring that we slow down the entry and spread of any variants that are emerging. But as I say, the evidence to date is the vaccines we have are effective, and certainly the proof is in the results we're seeing in terms of illness, hospitalizations and cases among healthcare workers and older people.
Okay, thanks, Colm. I have a question perhaps for Anne O'Connor about the investment in future services that we have seen an unprecedented level of investment in healthcare. Has COVID-19 accelerated a shift to community services? Will there be perhaps proportionately greater investment in community services than there otherwise would have been based on the experience we have had over the past year?
Absolutely. I mean, I think we've seen as part of the winter plan this year, the massive investment in community services that allowed us to build on things that we'd started really over the last 3 years at a much, much smaller scale. I mean, the investment in winter previously, I think the most we got to was 40 million and last year was about 26, whereas this year, it's 600 million. So there's a massive difference there. And really what it's doing is allowing us to embed initiatives that we all want to deliver on. Things like our integrated care for older persons, our integrated care programs for people with chronic disease, our enhanced community care, GP access to diagnostics, all of these things that we know make sense in terms of supporting people to live well at home. And I think what it's really allowing us to do is to make that shift where it's not just about avoiding hospitals, it's actually about keeping people well, or at least wrapping care around people at a much higher level of acuity than we've ever done before. So we are seeing many people now supported in community services who really up to this year or last year would have had no option but to go into either acute settings or into nursing homes and all of that. And it's worth noting that, we are seeing a reduction in the applications for nursing homes at the minute. And we are also seeing a massive increase in the spend in home support. So we're now able to support people that we wouldn't have been able to support, being honest, in terms of the cost of care and all of that. So absolutely, the investment this year, so the pandemic has given us a push that we were already on a particular journey, but it's really accelerated us and allowed us to develop these initiatives that are so important in terms of delivering on that mission in Sláinte Care, delivering on that plan to really develop our community services, to really have population-based care for people. So no doubt about it, Mark, I think that it has been hugely positive from that perspective.
Okay, and it doesn't feel quite right to be talking about positive effects of the pandemic, obviously, in light of what everyone's been through over the past year. But in terms of the remote working, the developments in information technology, the changes in the way we work, are there positives for the health service in going into the future? And will some of the changes we have seen stay when this is finally over?
Yeah, I mean, I think so. I think in terms of what we've seen, so we really have seen staff working from home in a way that we've never seen before, obviously, because we really wanted people to work from home. And I think that we've certainly set up systems now that we never had in place. So even just access to systems for people remotely, having team working remotely. So we now take Teams and Zoom for granted, whereas this time last year we were all struggling to take ourselves off mute. And I think that it's a really positive development. I think there's a balance. So certainly as we return, and we are talking about the return to safe services, but we also have to return to safe working. Which may mean more of a hybrid model, I think. I'm not sure that having everybody working remotely is the best way in terms of culture and team development. It's nice to be able to actually meet people every now and again. So as it is safe to do so, I think we will see a kind of a version emerging, which will be a mix. And certainly the work, and it's worth noting, the work that our colleagues in the Office of the Chief Information Officer and all of the people working around the country in terms of technology, they have been working flat out since this time last year, developing systems around COVID, developing all of those really critical systems. They're now on the whole vaccination systems, but equally supporting all of us to work remotely. And the challenge there in terms of the provision of IT systems for people has been huge. So I think, Mark, absolutely we can see that it's going to be here to stay. And I think we will have to see what shape that takes as we come out of this, whenever that is.
Okay. Some of the staff on this webinar were on the last all-staff webinar we had, which was about the launch of the corporate plan. And I'm just wondering, Paul, I mean, the corporate plan obviously contained ambitions for the evolution of the HSE over the coming years. To what extent has that been affected, or to what extent has any of it been kind of put on hold in a way by the pandemic, or are we moving ahead with some of those changes?
Yeah, I think we've been asked this on many occasions. Has the pandemic set back reform of the healthcare agenda? And like Anne, I actually think the opposite. I think what we've had to put in place for the last time, for the last while, and I said this very publicly yesterday, was, we've put in place in matters of weeks and sometimes months what would have taken us years to put in place. And that's great credit to everybody who's had to put those changes in place. And so looking at that from the corporate plan, and the board approved our corporate plan, it's been published just recently. The corporate plan, sets out for the next 3 to 5 years some of the priorities. And they are largely building on a lot of what has been done. So there's kind of 6 broad areas on it. The first one is obviously to continuously protect, and we know we will have to protect our services through COVID. And the second one is always looking at how do we strengthen our capacity in terms of our acute services and addressing many of the challenges we touched on earlier on, particularly in terms of waiting lists, but about new pathways and reform of new pathways of care within our acute services. Equally, and Anne just touched on it, how do we enhance our community care services to support the acute services and indeed have better integration between both? And many of the examples, if you take it over the last year, that we put in place, whether it's increased supports for people, older people at home, whether it's a very new role for our national ambulance services, who are no longer just a 24/7 pandemic response force. They've been vaccinating, they've been in testing and tracing, they've been in nursing homes, they've been supporting multidisciplinary teams. So a very new role for our national ambulance services. Our GPs, how we work in the community with our GPs having access to diagnostics, COVID response hubs, a great learning about what they could provide for us in the future, even after COVID. Step down care, integrated teams, a whole new way in the second area. The third area largely revolves around mental health services, and the fourth is our disabilities. But also then looking at some of the elements of healthcare that we know we are outliers in. So for example, on obesity, or in terms of early prevention of childcare, or early childcare prevention health methods, and indeed in terms of alcohol. And we know as a country, we have significant issues in terms of the use or abuse of alcohol. So the kind of corporate plan stood above all of that and set out a kind of roadmap, if you like. But what I would say to people, sometimes we can get lost in corporate plans. There's something out there in the future. For me, it's about building and consolidating many of the good initiatives that we've had to put in place over the last year, seeking the funding which we have gotten for this year, demonstrating our form and ability to consolidate them and get the benefits of them this year, and then get enhanced government funding for them for the next couple of years. So I think our corporate plan is very well grounded and builds on a lot of what's happened last year.
Okay, thanks very much, Paul. I see a very practical vaccination question coming in. If somebody has received the first dose of Astra Zeneca, like many healthcare workers have done, and have had no negative side effects, will they automatically receive a second dose of Astra Zeneca, or will there be some suggestion that perhaps they take a different vaccination for dose 2?
The first thing to point out, Mark, is that side effects are relatively minor side effects are common with all the vaccinations. We know people who receive them report sore arm, sometimes a flu-like illness, pain in their muscle, headaches. So there's relatively common constellation of side effects that one gets with, including with the flu vaccine, but also with all the vaccines that are currently available. So the question is probably referring to this rare reported side effect of this clotting illness associated with low platelets. And as I said earlier, the EMA has done a deep investigation of about 84 of these, but there's been over 200 altogether reported through the EMA and UK reporting systems. So the advice we received from NIAC has been quite clear that if you've received your first dose and you're over 60, it's in your interest to get that second dose 12 weeks later, because that will complete your vaccination course, afford you full protection, and of course have you labelled or as fully vaccinated. If you're below 60 years of age and you have one of these underlying conditions that categorizes you as very high risk or high risk, again, it's in your interest to get that second vaccination within 12 weeks. For all other people, and that means people less than 60 years of age and people who have no underlying conditions. It's a great bulk of people who've received the first dose of AstraZeneca to date. The advice from NIAC is to protract out that second dose for 16 weeks to give them time, along with the EMA and the other regulatory agencies, to gauge what evidence there is to the relative pluses and minuses of getting a second dose. The bias and the slant will certainly be towards getting a second dose, because that's how the research went through, that's how the drug was licensed, that's what we call full vaccination. But because of the somewhat doubt over the relative risks and benefits, given there's very rare side effects, they're going to ask for that second dose to be protracted to 16 weeks for those under 60 with no underlying conditions, to give more time working with the EMA and other European countries to come up with the most closely aligned advice between all countries.
Okay, thanks, Colm. Interesting kind of personal question for the three of you. The new right to disconnect, the right to turn off your phone, to not be at the end of your email at 24/7 all the time. Do the three of you practice it in any way? I have to say, from personal experience, I don't think any of you actually do. But do you practice the right to disconnect at all? Do you have any time when you're not connected? And what would you say to staff about it?
I suppose, in fairness to Colm and yourself, probably one of the reasons you're not disconnecting is because I'm probably contacting you. So maybe I have to take the lead on this one. But I think, look, this is a real challenge for all of us who are working in healthcare services, but a real actually obligation on us all and our families in particular to take it really serious, because, you know, the consequences of not disconnecting can be very significant in all of our mental health, but also significant on our families and the impacts that they carry that we don't always see. So certainly from my perspective, you know, it is something I think we're going to have to work at. How will I practice it, or how will I think about it? Probably listen to my wife a bit more, because she certainly has been an advocate of this well before any legislation emerges. So I think it's something I think we really need to build into our way of working. We all know we have to be available, and we always are available, but I think we have to de-routinize it, I suppose, a little bit, and make really hard efforts.
And Anne or Colin, do you turn off the machines ever?
Yeah, I'm here now crafting my out of office reply for Paul. But I think, look, I mean, it's extraordinary times too. So absolutely. And I'd like to think I do disconnect. I actually, I'm quite good at switching off. I do lots of other things. Not that you can go very far at the minute, but I would do other things. I would in the evenings. You know, I have 3 teenagers, and just actually being able to get out and about and, you know, switch off is very important to me. So I think, yes, and I think we're certainly, you know, we're all responsible for that. We're all responsible for how we can look after ourselves and also our teams. And I think that's something that we try and do. And hopefully now, when things have settled a bit, so I know the vaccination situation is very lively still, but you know, there's a sense of some level of kind of normality returning, even though we're still very busy. Services are very busy. With the COVID numbers going down, we're able to start working, I think, in a slightly more normal way. So it's something for us all to work on, I think, Mark.
Colin.
Well, in short, no, but I'm aware most healthcare workers listening today, and those I know about, will it's part of their lives that they're locked into, is to have their phones available, and we know the vaccination program is heavily reliant on that kind of voluntary work and availability of people. And throughout the pandemic, the past year, people were volunteering to help in ITUs, to support care outside normal environments, nursing homes, and so on. So. And the mobile phone was a greater neighbour of this. So, but as Anne says and Paul says, as we hopefully calibrate down against the falling figures we're seeing, we'll see people be able to reclaim their own time. But I think overall that phone availability, not just for us here, but for healthcare workers throughout the country, was something was needed during this crisis.
Okay, I see a very broad question coming up there. Does anyone think we're at the beginning of the end of the pandemic?
I think one thing we should all ban after COVID is too many of these cliches and statements, because you know, I was nearly going to urge an abundance of caution just in terms of the next one that comes along, because there's so many of them emerged throughout these. But I think just the trust of it, I do get a sense, looking at what's happening, Colm touched on this, worldwide, the effectiveness of the vaccine, not just in terms of protecting illness, but transmission, the scale of which we're now heading into a rollout program, notwithstanding what we'll always have to deal with, which are, you know, variants. And as you heard in Europe yesterday, it basically is, this has to be part of our strategic plan for the future, for the next few years, you know, vaccinating people. So it's probably something that's with us for a while, but I do get a strong sense we can see the light much, much brighter now. And we can see we can see ourselves getting our society back. We can see ourselves getting our economy back. Hopefully we can see ourselves getting our families back, who we haven't been able to see for a long time. So yeah, I do think we're on the right side of it.
Okay, a question here. There was a review of the centre of the HSE, review of the central organisation, and where does that stand?
Yeah, I'd probably take that, Mark, very briefly. Just say, yeah, this is one we've had to start and stop and pause every wave that we've got. We just have done a significant amount of work with the executive team. I'm actually kind of glad we didn't go about it when we had planned to go about it, which was the first quarter of last year, because the learnings from the pandemic tell us what is important at the centre. And what is important at the centre, if you just look forward, a testing and tracing programme that we never had before, with almost 2,000 of a workforce now. And that's not something that can be easy or should be distributed. It does need a national coordination. Secondly, things like vaccination programs. Like I just said, we're now looking at that being a core part of our strategy actually for the next 3 years. So we have to build around that. Public health and public health systems and public health organisations now actually at the core of everything we're doing, and have to come more to the core for the future. So I'm kind of glad we didn't do it when we planned to do it, because we've had so much learning since COVID. Quick summary where we're at now. I see this as kind of an evolution rather than a revolution of the centre. And we do plan in May to put in place the executive structure and reporting structures around that reflect all those new priorities. That's the status, Mark.
Okay, the sense that there's a lot of goodwill towards the health service that has grown over the past year. Obviously, there have been a lot of criticisms as well in the media about the pace of the vaccination rollout, etc. But that overall, staff, I think, have a sense that there's a lot of goodwill. How do we retain that into the future? That if we return to some form of normality, how do we retain that goodwill, that positivity?
I'll make a quick comment, Mark, and Anne and Colm, I'm sure we'll have valued comments on this one. A few quick comments. First of all, you could be misled if you took the public mood from social media, I believe, because social media is a very useful tool, and we use it as an organisation, and I use it quite a lot for communicating out information. But it can be quite a toxic space, and I can see how it affects some people's mental health and some young people's mental health in particular. It's something I think in the future, when it's regulated stronger, we'll all look back and say, how could anybody ever say that about anybody else completely public? So I think we'd be careful around social media, but I think it's a very good tool overall. But on a substantive point, I think if we know why the public trusts us more during the last year, and some of the research tells us, firstly, they heard a more coherent voice coming from the health system. And I think that's an important one for us, because I think we've all had the experience of before where we're all arguing against each other. Consultants are having a pop off. HSE, we're arguing with trade unions, and we're arguing with many stakeholders. And that's not to say we shouldn't be having arguments, but how the public perceive that, I think, is an important lesson for us. So how we give confidence to the public by having a very coherent and clear voice about health, what we care for them, I think is going to be a really important one, I believe, for us in the future. And finally, while I say social media can be, you could be misled, on any given week, I get about 10 to 15 letters, cards, emails, of correspondence from the public. And it's really just to reflect back to our teams. They ask me, and we do post them, to reflect back to our teams, really positive messages from the public that they want to share, that they want to relay back to us. Nice cards, nice gestures, nice emails, and people go to the time to write something like this. So I think we should build on what we've done today, is my view.
Yeah.
And I think, Mark, for me, there's, I think, building on what Paul said there, the reality is everybody's experience of the health system is a very personal thing. So, if you're waiting for an appointment, if the family member's waiting for an appointment, or you're being seen, and it is often the little things that matter to people. So from my perspective, in terms of looking at how we can improve things, it is really about just, it's that access dilemma. So in terms of people being seen in a timely way, but even just not overcomplicating things. So sometimes, we set out to deliver services in a way that are actually very complicated, and often what the person wants is something really quite simple. So we have to listen to people. We have to hear what people want. We have to look at the experience they currently have and how we can improve on that. And I think it is about, and that's not to oversimplify something that can be very complex. So in terms of just the access to our system across the board, but critically ensuring that people have access at the appropriate place, at the appropriate level of, I suppose, of complexity in terms of our services. Everything doesn't require very specialist services. Everybody doesn't need that all the time. So for me, it's about how we can really continue to build on what we talked about earlier in terms of just that community-based approach, or where people do need hospital services, that, you know, we can respond in a way that's really supportive of people, looking at how we can have quick access to services, and really focusing on what we do, which is really about providing healthcare services to people. And I think we have an opportunity now with the level of investment, you know, with Paul mentioned earlier, just I suppose the scale of the recruitment that, you know, we're being funded for this year, that we can really try and build on what we've done in the past year to respond to people. And I think that will engender the goodwill. So it is about not being overly bureaucratic towards people, but actually being able to deliver services in a way that's meaningful. And for me, that's something that we're absolutely going to continue focusing on.
Okay. Question here for Colm. I think we've been over some of this ground, but with the very positive signs we're seeing of reduced infection rates, is it as important to reiterate the importance of maintaining public health measures? In other words, would we have a view? I know these decisions are all for government at the end of the day on what to do about public health measures, but would we be a little bit more relaxed than we might have been a few months ago about seeing some level of relaxation?
I know we always say what a good question when we agree with the question. So that is a great question, and obviously come from somebody who understands that the role of vaccination program and vaccinations do not replace what has been an enormous worldwide population and individual public health response. They enhance it in time. And to go back to that question somebody asked earlier, can you pass it on? In time, if the evidence gains strength that we stop transmitting the virus to each other because of vaccination, and that a sufficient proportion of the population get covered, certainly you can then envisage a relaxation, as we're beginning to see already, a relaxation of those public health measures. At this point in time, what we see is there is a significant addition to the armory of a public health response. They also give us other options. They're opening up options for us now because our hospitals are safer, our hospitals are less threatened, our numbers of people in hospitals and ITUs are falling, and these increase options to us. And now we're getting good figures today. Even just I came from NEFIT straight away, where we're seeing that falling, 14-day incidence now falling, the number of people in the hospital falling below 200. So the vaccination program will increase options for ourselves and for government, and that can only be welcomed.
Okay, thank you very much. And I have to apologise for my lack of proficiency in the Irish language, but I see a member of staff has asked the Chief Clinical Officer, whose Irish is much better than any of the rest of us, to say something to them. This staff member is retiring at the end of the month, and I was wondering, would they have any message to give to them and indeed the staff generally? As Gaeilge.
Go míle maith agus díos an cétá gestan seach gimid gach rá agus blahart agus tá sé géirí machasan géirí asan an choras láin is so agus buchas a gohhail ahan duine tá géisteach aniu agus don ian ilig fud na tíre tá tír gan áras tan tír go hiús go haman an cai ahan duine fud an tíre buchas a gohhail de ahan duine fud an tíre san Arnáid sláinte. Go míle maith.
Thank you very much, Colm. Gurbiel Mahagat, Agus Anish. There is just a few minutes left. Could I perhaps ask each of you just to give a final message, anything you'd like to say to staff as we face into hopefully what will be a better quarter than the first quarter of this year has been?
Hannah, Colm, do you want to go first?
Yeah, I mean, I suppose just to build on what we've been saying, we know this hasn't been easy, and we know that people have been asked to do a lot. And just to say thank you for that. And really my plea as ever at these is for people to look out for themselves. You know, I think sometimes the burden, and we do know that the psychological impacts of what we've been through might only start to become apparent as things ease, because people are caught up in the frenzy of all of the activity. So I would urge people to look after themselves. The weather's getting better. Focus on the little things that you can do to look after yourself. And let's try and get back to some sense of, as I said, some kind of normality in terms of how we're working together, how we're supporting each other, and focus on the things that are important in terms of family life, home life, as well as work. And really just end on that from my perspective, Mark.
Okay. Colm?
I'd just like to echo what Anne says. I think that's what she says really resonates with me, that we know after obvious events such as major disasters that occur in hospitals, and I've been visited places and in other ways where this happened, that everybody was in a frenzy and adrenalized during it, and they fueled each other on to go through that experience. But the uniform message coming out of it was this sense after huge fatigue and personal toll. And I think people need to watch themselves now. It's been a really tough year, and it's been a particularly tough January, where we saw over half of the total cases in that month alone that we've seen since the beginning of this pandemic. And I would urge people, get your leave, mind yourself, and just take care of your garden in every sense of the word.
Okay, and Paul?
Yeah, and again, similar team. I feel the need to reflect back to everybody. We were just briefing government yesterday, the three-party leaders, before a cabinet meeting, and three-party leaders purposely turned to myself and one of my colleagues and just asked that we relay back to all staff within the HSE the sincere thanks of government from the Taoiseach throughout all the Taoiseach and all the ministers for their thanks to everybody for what's been a really difficult quarter, but a really difficult year overall. So I just want to relay that back to everybody. It was very well meant. It was very heartfelt as the Taoiseach delivered it. So I can't do it justice, but just to say that's exactly what he has asked me to pass on. And from myself, just to say that we are, as a team in the HSE, really proud of what everybody's achieved. And look, let's just stick together, support each other. And we do have a better 2021 ahead of us. I'm very confident of that. It will remain unpredictable and there'll be many bumps along the way, but it will be a better year.
Okay, thank you very much, Paul. And on that note, I think we'll draw things to a close. The sun is actually shining here on Dr. Stephen's Hospital, and I hope it's shining wherever you are as well. Thanks for joining us. There'll be a recording of this webinar available on the staff website. And thank you very much.